Hello, everyone. We're back with a special episode of Plug Into Devon. And today I have as my guest my son Dayton Thorpe, who is a data scientist. He has a PhD and he's based in Silicon Valley. We're going to talk a little bit about some of the work he's been doing around coronavirus and the pandemic. He's been doing fascinating data stuff kind of as a side project. So stick around. You don't want to miss this. Well, Dayton, welcome to the show.
Thank you. I'm glad to be here.
Oh, not nearly as glad as I am. I love every minute I get to spend with you, and having you on the show is just a great excuse to have a little more father-son time. So thank you. We'll let a few other people watch today. But Dayton, tell us about your coronavirus data work over the last couple of weeks.
Yeah, I feel compelled to throw in that my PhD is in physics, so it's not directly relevant beyond that I did some math. But yeah, like everyone in the world, I'm very interested in coronavirus right now. Couldn't stop thinking about it, so I decided just to try to keep track of things systematically, both the research and the progression of the virus and our fight against it. So I've been doing some quantitative work on the spread of the virus in all 50 states. Really what I was interested in at first that I hadn't seen elsewhere was plotting the exponential growth of the virus in 50 states. I'd seen people plotting it in different countries, but not at the state level. So I was very interested in California and Utah. So I made that plot for myself. And then other people started requesting plots for the states where they live. And now I've just done all 50 states. And I just update them once a day so we can all check in on how our state is doing.
50 states plus Guam, the U.S. Virgin Islands, and Puerto Rico. Did I miss anything?
And as of yesterday, also the North Mariana Islands, which have 2 cases.
Oh my gosh. And do you know what the population of the North Mariana Islands is?
I looked it up just for this, and it's 50,000. So they're starting, actually, that's kind of a high place to start.
Yeah, but it's hard to go from 0 to a low percentage among 50,000.
Yeah.
So they jump in right in the middle of the soup.
Yeah.
That's kind of scary for a small population like that.
It is.
You hope to stay at 0 if you're in the North Mariana Islands.
Yeah, I hope they have a good hospital.
That is a scary thought. It's one of the things that we're seeing down in San Juan County is, the Navajo Nation that straddles, I think, 4 states, is having a real surge, and they have not nearly enough medical care. You haven't broken out the data for the Navajo Nation, but given where we are in time, I think the first cases in the Navajo Nation are less than 2 weeks old. Where do you see that going? Should they be worried?
Yeah, so if you don't have strict controls, things like stay-at-home orders, closing schools, the virus will double every 2, 3, 4 days. Depends a little bit on how close together people are. If they're spread out, it might be a little bit slower, but it's still doubling every 4 days. Is still, that factor of 2 gets away from you really, really quickly. So people definitely need things like staying home from work, staying home from school, to keep it at all manageable.
How well are you seeing that working in California? So there's been a stay-at-home, shelter-in-place order, I think, now for about 2 weeks. Is California really seeing a bend in the curve yet?
So it's hard to see in the data yet. From the time you get infected, it takes about 5 days to show symptoms. From there, it probably takes a couple days to get a test. The governor says tests are getting returned in 6, 7, or 8 days. I've heard some people complaining that their test took 2 weeks to come back. So there's a really big lag between when you get infected and when we all know about it. So it's kind of hard to tell, but it should show up any day now, really hinging on how quickly are the tests coming back. There's a science paper, a paper in the magazine Science came out that looked at the growth of the virus in China after they implemented their lockdown, and they said the growth rate immediately switched over to being negative once you attribute cases back to when they likely occurred. So I'm optimistic the same thing has already happened here, even though we can't really tell yet.
And so the same would be true on the Navajo Nation, not to,
Yes.
to be too focused, but they started their lockdown, I think, about 48 hours ago. As we're recording this, by the time this airs, it could be a week ago. But in any case, they are that lockdown should be effective, is what you're saying.
Yes, I'm optimistic that's effective. Yeah.
It's interesting. You've used in a lot of your charts, as you look at state-by-state data, a comparison to two countries. One is Italy, where things went pretty badly, and the other comparison is to South Korea, where things have gone really well. I heard just today they still haven't had 10,000 cases. And so they've really done a remarkable job of locking things down. And so you plot as a percentage of the population each state against those two curves. And it's interesting that some states seem to be in their early days tracking a fair bit worse than Italy. What do you make of that?
Yeah. It's, there's a lot of uncertainty in the fog of war, the fog of pandemic, but the optimistic case for us would be, for the United States, would be that our testing is better. It's really, frankly, just hard to tell. There's just so little information, it's really hard to tell, but our testing could be better, which would be the optimistic case for us relative to Italy. We've learned from their experience, so a lot of California, a lot of other places implemented stay-at-home orders earlier on in the curve than Italy did. So because it takes a couple of weeks to show up in the data, we should still turn out to be better than they are. New York is going to be tough. It's very rough. It's going to be very, very rough. It already is, obviously.
Yeah, New York is quite a bit worse on your plots than Italy.
Yes. Yes. I hope that just means they're identifying all the cases, but even if they've identified every single case, that's already a lot of cases.
Yeah.
You don't want to make light of it at all. Yeah.
Yeah, it's very scary. As we look out over the coming months, there really isn't a quick path to zero, literally zero. So how many people should we expect ultimately to be infected in the United States? Right now, we're at around a little over 100,000 as you and I are recording this, the low 100,000s. Where do you think it will go in terms of infections in the country?
I'm super tempted to switch to another window, but I won't. There are a few different models, a few different groups that have tried to forecast this, and we're probably talking on the order of, let's see, so probably on the order of 10 million infections. And that would be, a lot of those we won't find out about until after. There'll be some modeling and some population sampling that goes on a year from now to figure out how many cases were there that we never identified, or they had mild cases and they never even asked to be tested. So that 10 million number would include all of those. So that's not 10 million people in the hospital. But it looks like the fatalities will probably be in the ballpark of 100,000, 200,000. That's what Dr. Fauci is talking about. And the infection fatality rate is about 1%. So, multiply that by 100 to get the total number of infections.
Yeah, those are scary numbers. To put that into perspective, that I guess is more than the fatalities each year from opioids, car accidents, and guns put together, right? But it's well below the number of cancer deaths every year, right?
Yeah, it's tough to. I've been doing my best to strike sort of the middle zone of some people say, "Oh, don't worry about it at all." I don't think that's the correct answer. Some people seem to be concerned it's the apocalypse. I don't think it's that either. The middle zone of it's a really big deal, but we'll get through it. I think is about where we should be.
Yeah. Well, Dayton, I really appreciate you taking some time to talk about this. I know I and a lot of my friends have started following your work on this rather closely. A lot of us are checking in each evening to see your updates, as you tend to post them in the evenings. And so we're really glad to get them and appreciate you taking the time to explain them. Before you go, I wonder if you'd answer one more question, Dayton, which is to say, what is your superpower?
I guess I would say it's being empirically driven, or maybe to use a smaller word, data driven. That's more buzzwordy, but I'll say being data driven.
Well, that is an excellent superpower, to be data driven. I think you're also a data driver.
I hope so.
I don't mean data manipulator so much as that you are the one who knows how to use the numbers to make sense of them. So anyway, great superpower. And if I can just say so as your father, I'm very proud of you. So thank you very much. Is there anything you want to share in terms of links? Why don't you tell people, in fact, tell them about how to find How to 115 and how to follow your Facebook posts, if you will.
So I've been blogging for a few years on a site, howto115.com. It's just, I share public health news, which just interests me as a personal hobby. I'm sharing my work there and making all of my Facebook posts public. I'm sharing a lot more plots on Facebook than on my blog. It's just so easy to share lots of plots. I make those all public.
Great. And so your Facebook, do you know your Facebook profile address?
Dayton Thorpe, is that?
So it's probably Dayton, or facebook.com/Dayton Thorpe, probably.
Yeah. I signed up pretty early in the Facebook years, so probably I got my name.
Yeah.
Okay. I'm not sure.
I'll double check and I'll put a link somewhere in the show notes for your actual page, especially if it's not that.
Yes.
Well, Dayton, thank you very much. We appreciate your work and I hope that you'll be able to continue doing that, help us stay clear, focused on the reality that the data shows in terms of this pandemic. So thank you very much.
Thank you.
All righty. Let's do some good. I'm Dayton Thorpe. For the last 8 years, I've been working full-time to eradicate extreme poverty, improve global health, and fight climate change. I've concluded that the best way for me to continue my work is to run for Congress to represent the people of Utah's 3rd District. In Utah, we have common shared values. Those things unite us. I believe passionately in our ability to come together, and I believe that working together, we can solve Utah's problems. I'm Dayton Thorpe. I'm a Democrat. I'm running to represent the people of Utah's 3rd District. I'm Dayton Thorpe, a candidate for Congress, and I approved this message.